So, how do you think your body handles the elevated amount of glucose produced whenever you're done eating the rice, gari, and even drinking that your coke? My name is Femisito Bangokon. Please pay attention because we are going to discuss something very important, and that is the role of insulin in the metabolism of glucose and in the management of type 2 diabetes. If you are yet to subscribe to this YouTube channel, you are missing a lot. Let's go. Insulin is a peptide hormone. What I mean by peptide there is that it has chain of amino acid. It is produced by the beta cells of the pancreas. It is released to the bloodstream by elevated amount of glucose in the blood. So when the glucose levels in the blood is very high, this will send a signal to the beta cells of the pancreas to release insulin. This is done by just membrane depolarization of beta cells, then insulin is released. The released insulin will now help the cells to pick up glucose, the high amount of glucose from the blood to use. Now, apart from picking, it will now convert the excess amount of glucose that is produced into glycogen stored in the liver and muscles. You see, your body knows saving culture. You that earn up to 100,000 naira monthly before the end of the month, you don't chop it and finish. See your life. Back to the discussion. Now, the insulin produced will now help the cells to pick this glucose from the blood, stored as glycogen and used by the cells for normal functioning. Now, an individual that has issues with glucose metabolism and is also experiencing insulin resistance, that is in type 2 diabetes, this is the problem. The body will produce this insulin, sent the pancreas will release the insulin sent to the body so that it could help the cells pick up this glucose. But the cells are not sensitive to the released insulin. The insulin might be there, but the cells do not recognize it. And because of that, the cells can this insulin produced cannot help the cells to pick up glucose, and this will result in high amount of glucose still in the blood. And like I told you, I said that insulin release is triggered by high amount of glucose in the blood. So the elevated amount of glucose in the blood, if still in the presence of insulin, will send another signal to the pancreas to send more insulin. And this is what leads to what we call insulinemia. That's hyperinsulinemia, high amount of insulin in the blood. So now let's talk about the glycogen stored. The excess glycogen that was stored by the influence of insulin is still useful. When you are fasting or you are starving, the body will now break down the excess amount of glycogen that was stored in the liver back to glucose, so that your body can function and the brain can still be working. But the one that was stored in the muscles will be used up still to give you energy. But when you are starving for so long or fasting for so long, doing 7 days dry fast, I'm not against you going for fasting, but this is what happens when you're fasting. When you're going for 7 days, 20 days, or whatever day fasting, when the glycogen that was stored in the body is gone, is finished, the stores are depleted, the body will look for alternative molecule, example amino acid and fat. The body will break them down still to give you glucose. This is why those that have gone for 20 days, 15 days fasting, when they are out, they are thin because of depleted stores of glycogen and the body using up fat and amino acid from the muscles. This is what it is known as muscle wasting. So if you are yet to, I want to stop here. Now, by my next video, I will discuss insulin resistance, the effect of hyperinsulinemia in type 2 diabetes. If you're diabetic, you should watch this video. So if you are yet to either follow my page or subscribe to my channel, you are missing a lot because a lot is going on there. Do that and you'll be glad you did.